Good afternoon. My name is Dr. Indra Randawa, and I'm the founder and chief executive officer of the Translational Pulmonary and Immunology Research Center. It's my pleasure to give you another update today on the coronavirus pandemic. All in all, we are seeing that the federal and state governments are moving towards a state of reopening the economy. This is something we have discussed and actually predicted many weeks ago on our calendar format timeline. Why the government is actually starting to look at this now at a typical start point of the end of April or May is because they're trending the number of cases across the United States. 3.5 million Americans have been tested for coronavirus. And when you start to trend the number of positive cases across the US, we're seeing a nice steady decline. In addition, the number of fatal events on a day-by-day basis largely is starting to hit a steady type of decline. The better way to understand this is look at other countries. Look at Germany, look at South Korea, and if you study the way their trends have occurred, in a period of typically 9 to 10 days, the peak format of coronavirus infection and fatal events would go from top to bottom. In the United States, unfortunately, we're looking at almost a 4 to 6 week cycle of achieving that. So the anticipation here is that in the next 2 to 3 weeks, we'll be on that hard downward turning end of fatal events and the hard downward turning end of actual case positives. And all in all, that is very good news. The United States, unfortunately, has taken a long time to achieve this endpoint effect. And the truth is, we have lost 35,000 lives in this process. And I think it's absolutely critical that we look at what has occurred with coronavirus, with this pandemic across our health system and our society, and ask ourselves, what could we have done better? It is very clear that a delay in quarantine, a delay in asking us to change our habits of hygiene resulted in this significant outcome of 35,000 deaths. It's also very clear that a delay in medical management, a delay in finding a way to actually treat these patients early in their disease course has led to this unfortunate number. It's also very clear that excessive amounts of intubation and ventilator use, that being the final straw for many of these patients, resulted in this very high death count. And certainly the inability to protect the elderly is clear. I think when it's all said and done, we may see that 1/3 and potentially up to 40% of the deaths in the United States were individuals who are at long-term assisted care facilities or nursing homes. And I think that's an extremely unfortunate reality. And in the end, what led to this large number of fatal events was purely a lack of testing. The lack of testing and the lack of quick results to help direct what next steps are for the majority of people is what led to this significant catastrophe that we're dealing with and hopefully is now starting to be behind us. So I'd like to spend the rest of the presentation today to talk specifically about testing. So why is testing so important? Well, it's best understood and best seen when you look at it across the timeline of what coronavirus really looks like. The fact is, from a pre-symptomatic or an asymptomatic state all the way through the disease itself into recovery, we may be looking at a 28 to 30 day type event. So when we want to test folks is anywhere across that 30-day time frame. So if we're looking at the pre-symptomatic phase, those are times that we typically are looking at folks who've had a potential exposure. Maybe there's a loved one, somebody at work, you may have had some type of exposure. Those are pre-symptomatic or asymptomatic type phases of testing. So we need to make sure that testing is accurate in that early phase of this disease. Obviously, if you start to have a fever, start to have coughing episodes or some of the severe symptoms that are present, there's a testing frame there for approximately 4 to 6 days where we need the highest level of accuracy so we can actually start to make the proper medical recommendations and deploy the right type of treatment. On the downward trend of this actual infection cycle, we also want to know who is still actively sick. We want to know who is actually past a point of needing a quarantine, and all the way out to the 28-day cycle, who is continuing to replicate the virus particles and potentially shed them to their community. That's another very important thing we want to track, because when you talk about contact tracing, those are some of the most important tracing numbers that we can have to prevent widespread community type outbreaks. The actual different types of tests that are available are complex. And unfortunately, there's no simple way to explain this, but it's best understood by the different types of tests, which are seen in this diagram, and the tests that are utilized during different types of phases of the actual disease itself. You can generally think of testing when it comes to this virus as two major types. One is an immunity-based test, or a test of your immune system's response towards the actual virus. And the second is the actual test towards a virus particle or a part of the virus gene that's being expressed during an active infection. So those are the two major areas that are being studied. You're going to hear a lot of different information over time as these tests become FDA approved. That's also another aspect that you should pay close attention to. Remember, this has been a rapid pandemic. So many of the tests are under what's called an Emergency Use Act of approval, and indeed every place that is utilizing this type of test right now is typically using testing that is under the EUA Act of the FDA. PCR testing itself has been around for the better part of 30 to 40 years. It's been highly effective across many different types of diseases. The PCR testing is done via a swab. This is something that you've largely seen done across the media. Initially, the swab had to be done inside the nose and actually deep inside the nostril itself. But due to better technologies and better specimen access points, you can now actually do the swab effectively in the back of the throat. But one of the key aspects of this test is that you must actually have the right specimen. You got to hit what they call the sweet spot, meaning you have to actually obtain the sputum or the mucus lining of the lungs, of the upper airway, or the back of the nose. That's where this virus lives. Once you actually capture that in a swab, that swab is then placed in a buffer, and the buffer is placed in an actual PCR machine. One of the greatest frustrations of PCR is that it requires a significant amount of thermal cycling. Temperatures have to go up and down, and various enzymes have to be deployed in order to express that particular virus particle. When it's all said and done, that sometimes takes 6 to 8 hours, and that's why the results of PCR sometimes have been delayed many, many days. However, regardless, when you choose the right type of primers, the primers are essentially the focused area of the gene that's being targeted for expression, you will get the best results if you get a good specimen. This is a test that's most active and most accurate in the first 3 to 4 days of the actual disease itself, and this is the one that's widely deployed across by the World Health Organization and widely across the United States right now. There's another form of PCR testing that's available, and this is again something you've heard about in the media, particularly towards Abbott Labs, but remember that it's not just Abbott Labs alone who has this test, and this is actually not a particularly new or novel type of testing. We have at least 5 other companies that have similar types of testing available, and the one main difference between this PCR test and the previous one I just mentioned is time. This test is actually done and can report a result back in about 5 to 10 minutes. How can it do that? Well, it doesn't require all that thermal cycling. So in other words, you don't have to change temperatures multiple times to get the proper expression. It actually focuses on a very specific gene target, and by specifically hitting that gene target in a proper sample, you can actually do this in an isothermal format and you get results back in about 5 minutes. The biggest problem with this test is the availability of this test. Right now, it's not widely available. I think in the next 2 to 3 months, you will see the availability of this expand in a very proper way and in a very positive way. The next form of testing that's done is actually done via blood. And this can be done by a blood draw through the arm or by a finger poke to give us enough blood to actually test how much protein antibodies your immune system is producing. Remember, we all produce antibodies all the time. We actually produce various types of antibodies during different types of infections. The best way to understand that are by the letter assignments. So IgM, or what's called immunoglobulin M, or we call antibody M, is an actual antibody that is present in the first few weeks of infection. And to be most accurate, it's actually present best in the first 1 to 2 weeks of an infection. So if you just got coronavirus, we may see this test positive in the first few days, and it might start to lag off. But then there's another antibody test that we have, and that's called IgG, or antibody G. And this is specific, again, towards coronavirus. And this starts to peak around week 2 to 3, and it could last many, many months. So when we talk about immunity, these are the things that we're trying to focus on, specific towards your body's immune system to produce this type of result. One of the biggest questions about antibody testing that's widely discussed right now is the accuracy of antibody testing. And indeed, none of these tests are 100% accurate. If you look at the nasal swab, some of the false negative rates can be as high as 30%. If you look at this antibody-based testing, depending on when you capture the patient for a test, it could also be as high as 20 to 25%. So the reality is the best way to actually assess disease states is to make sure you do the maximum number of testing possible across the board with rapid results to give patients the best options towards treatment. And I'll make one other comment about immunity. You'll often hear this term about immunity prevalence, words like herd immunity. So far to date, what is very interesting about this virus is that we are not seeing large numbers of patients having positive immunity. In fact, if you look at European data, it may be the case that only 3 to 4% of the general population has been exposed to this virus and actually produces immunity. And that is information we need to help us understand best how a vaccine will work, how many doses of a vaccine somebody will need. And that's why it's very important that when we do conduct testing, we do it widespread across the board with the entire spectrum testing actually available. The actual blood test itself is actually run on a cassette, and that cassette actually works really well with just literally 1 drop of blood. So that drop of blood is placed at the bottom of the cassette, and it actually goes through a filter paper up towards the upper part of the testing zone, which looks at your immune system's ability to bind the actual coronavirus proteins. And indeed, if you have never had exposure, you will see none of those lines positive. If you've had early exposure, you will see 1 or 2 of the lines positive. And if you've had exposure maybe 1 or 2 months before that, you will see a different line that turns positive, primarily the IgG line. So again, this type of testing has been widely available. It's been used for various other types of infectious diseases with a lot of success. But at the same time, this is something that we have just deployed now recently, and the efficacy of this has yet to be established. Again, overall best option is to actually do combinations of testing to get your maximum accuracy towards that patient. Understanding how testing actually occurs is critical, because no matter where you live, no matter where you may have access to testing, you need to be most knowledgeable to understand how a proper test should be conducted, and then eventually how to interpret those results. The first and foremost important factor in obtaining accurate results with coronavirus testing is to have trained medical personnel actually acquire the specimens that are needed. One of the greatest frustrations in current testing that's available for coronavirus is that many drive-in test centers require the patient to swab themselves. The accuracy of that can be very low, and if you add that to the accuracy of the test itself, you can understand that why a false negative test can be a real problem. So the actual testing itself should be conducted by a proper medically trained personnel, and they have to encourage the patient to actually cough up sputum from their upper lung utilizing a type of cough technique called a huff cough. And in doing so, the provider will actually visualize the back of the throat and collect the proper specimen sample from the upper trachea and the back of the throat. Once that is done accurately, that swab is placed in an appropriate buffer and is then sent off for PCR testing. The second and also important form of testing involves antibody testing, which requires a small drop of blood. In total, 10 microliters of blood is required for this test to be run accurately. The individual who is performing the test, again, should be a trained medical provider, and they will sterilize the initial access point, which is usually the finger. And after obtaining that initial drop of blood through a capillary action system, that drop of blood is placed in the actual cassette itself. What that drop of blood does is it moves up a capillary filter on the actual cassette, and then over a period of 5 to 10 minutes, you will get a proper result which determines which antibody levels are positive and which antibody levels are negative. The totality of these results, meaning the PCR result itself from the swab and the actual antibody results from the cassette, have to be reported together in total within 24 hours for the most accurate results. So to summarize, the utility of testing must be overlapped with the actual disease process of coronavirus. So we know that a typical case can potentially last over a 28 to 30 day period, and you want to figure out what targets actually hit the right time frame. So when you look at the actual PCR-based testing of a swab, it is the earliest start of the actual disease process. That is the target time where you're going to have the highest level of accuracy in the first 1 to 3 days of actual symptoms. Now, double that up with the actual IgM-based blood test around day 3 and potentially up to day 21. That accuracy of an acute or a subacute type of infection will be present. After 14 to 21 days, and potentially for months later, the IgG-based test positive will give you evidence that you've been exposed to coronavirus and you have overcome that virus. So hopefully this type of singular approach, this type of comprehensive approach of multiple level testing across the actual dynamic phase of what this virus is, gives us the best ability to not only diagnose the right patients, but you can exclude the patients who don't have the disease. And also of importance, those who've been actually previously exposed and were asymptomatic, you can now track and trace those individuals with the best ability possible. So given the testing that is available, we at our center have the ability now to conduct this testing in what I believe is the best possible way forward. In order to do proper testing for coronavirus, we must make sure we do things safely. We also must make sure that we are doing things safely not only for our patients, but for our employees. And what we are building here at our center, which actually goes live here in just a few days, is the ability to create the right type of environment where the risk of transmission is essentially zero. The actual location for testing is key. Our location for testing involves a negative pressure filter room. What that means is that no virus particles are allowed to stay in that room. It's very similar to an isolation room found in an ICU, and that's where we will conduct our testing. In addition, we will have an isolated parking and an isolated building. So individuals will not be seeing any other patients who are potentially coming in for testing, and check-in will be online. Yet another single way to make sure that there's a minimal amount of risk of transmission. Number two, staff interaction is very key. So our staff will absolutely be trained personnel. These are individuals who are medically trained in how to conduct not only the blood tests, but also the appropriate swab. And also very important is to make sure that they are handling the specimens properly. So if you get tested, you get an accurate result and you don't have to actually repeat the result because the handling of the specimens was not quite proper. In addition, we want to make sure that this is child friendly. We have children as young as 5 who can get tested accurately, and we'll make sure that we give them the best possible experience. Our employees will be wearing maximum personal protective equipment, full hazmat suit, N95 mask, full face shields, and even more than that. We want to make sure that our employees are absolutely safe. And we will only do one patient at a time. That's an important concept because, again, we want to minimize the risk of transmission. After each patient comes through, full decontamination, very important as well. We will be using Environmental Protection Agency certified materials to make sure that we decontaminate after every patient exposure, and that's also extremely important to reduce the risk of transmission. And lastly, results. Results do count. As we have all heard, many times viral results for coronavirus have taken 7 to 10 days to come back. Not here and not at our center. We will have results back in 12 to 24 hours, and those are comprehensive tests that will be presented under appropriate laboratory certification rules and regulations, and those will be sent directly to the patient. And if a patient does test positive, we will have direct contact with the public health officials as well to make sure the appropriate tracking and tracing of cases is done properly. So I will leave you with one last point, and that is testing is our next phase forward. There's really no other way to look at it. And if you believe in learning from the past, if we believe that we have learned from what has been an incredibly unusual, once-in-a-generation type experience, we can only look and say that other models have worked better than ours. And I'll give you just one simple example. California, which has largely been lauded for its efforts here and has done a reasonably good job, California has about 40 million people in the state. Of the 40 million people in this state, we've had a total of 30,000 positive cases and 1,000 deaths. Look at South Korea. South Korea has about the same population, actually 50 million, it has more. And of 50 million people who were present at a higher risk state of this coronavirus, only 10,000 positive cases and only 200 deaths. So we have to ask ourselves, what did they do differently than us? And the answer is very simple. Testing, testing, testing. They learned from their experience 5 years prior with the Middle East respiratory virus, MERS, which is again a 95% similar virus to coronavirus. They learned back then that they needed to have the maximum ability to test and track everybody when these things occur, and the results speak for themselves. And of interest, they've had absolutely no economic shutdown at all during their time, and their new case burden has actually been less than 10 cases per day for the last month. This is something that we must try to achieve. We can all do this. We can do this together as a society, and we can do this together as a medical system. And we need to instill confidence in everyone to make sure that we can get there. The first way you do that is by creating the right type of testing centers, much like we described for our current patient population. Number 2, we must learn how to protect ourselves better. And number 3, if we do test positive, what are the drugs out there? What are the actual treatments out there that can be deployed in an outpatient setting that give everybody the best possible options for the most successful forms of outcome? So next week, I will be back explaining specifically what you can do at home, talking about decontamination, talking specifically about the technology of face masks, and most importantly, the comprehensive approach of drug treatment that can be deployed in case somebody does test positive. I look forward to speaking to you again next week, and I hope you have a good weekend. Thank you.